The cerebral system, also the part of the motor system for normal rhythmic movement and the steady posture. To assist the coordination, observe the patient performing the rapid alternating movements, point to point movements, gait and other related body movements, and standing in the specific weights. In the rapid alternating movement, show the patient how to strike one hand on the thigh, raise the hand, turn it over, then strike back to the hand down on the same planes. Urge the patient to repeat these alternating movements as rapidly as possible. Observe the speed, rhythm, and the smoothness of the movements. Repeat with the other hand. The non dominant hand may perform less well. In the cerebral disease, instead of alternating quickly, these movements are slow, irregular, clumsy, and abnormality called dystonia. In the test rapid finger tapping, show the patient how to tap the distal joint of the thumb with the tip of the index finger, again as rapidly as possible. And observe the speed, rhythm, and smoothness of the movements. The non dominant side often performs less well. And for the legs, ask the patient to tap the ball of each foot in turns as quickly as possible on your hand or the floor. Not any slowness or awkwardness. Normally, the feet do not perform as well as the hands. In point to point movements, the first one is the arm finger to nose test. Ask the patient to touch your index finger and his or her nose alternatively several times. Move your finger so that the patient has to change directions and extend the arm fully to reach your finger. Observe the accuracy and smoothness of movement and watch for any tremor. In the cerebral disease, movements are clumsy, unsteady, and inappropriately variable in their speed, force, and the direction. In dysmetria, the patient's findings may initially overshoot the mark but then reach it fairly well. Now, hold your finger in one place so that the patient can touch it with one arm and finger overstretched. Ask the patient to raise the arm overhead and lower it again to touch your finger. After several repeats, ask the patient to close both eyes and try several more times. Repeat on the other side. Normally, the patient touches the examiner finger successfully with eyes open or closed. In the leg heel to shin test, ask the patient to place one heel on the opposite knee, then turn it down the shin to the big toe. Observe this movement for the smoothness and accuracy. Repetition with the patient eye closed test for position sense. Repeat on the other side. In the cerebral disease, the heel may overshoot the knee, then oscillate from side to side down the shin. In the gait, ask the patient to walk across the room or down the hall, then turn and come back. Observe the posture, balance, swinging of the arms, and movements of the legs. Normally, balance is intact. The arms swing symmetrically at the sides, and the turns are smooth. In the walk, heel to toe in a straight line called the tandem walking. Tandem walking may reveal the ataxia that is not otherwise obvious. In the walk of on the toes, then on the heels, this tests plantar flexion and dorsiflexion of the ankles as well as the balance. Hop in place on each foot in turn if the patient is not to it. The test proximal and distal muscle strength in the legs and require both normal position sense and the cerebral function. Difficulty in hopping points to weakness, lack of position sense or cerebral dysfunction. Now do a shallow knee bend first on one leg then on other. Steady the patient if you think the patient might fall. In difficulty doing the shallow knee bend, suggest the proximal weakness, that is the extension of the hips, then and weakness of the quadriceps, that is the extension of the knees. In the stance, the following two tests can often be performed concurrently. They differ only in the patient's arm position and in what you are assessing. In the first one is the Romberg test. This is mainly the test of the position sense. The patient should first stand with the feet together and eyes open and then close both eyes for 30 to 60 seconds without support. Note the patient's ability to maintain an upright posture. Normally any swaying is minimal. In ataxia from the dorsal column disease and loss of position sense, vision compensates for the sensory loss. The patient stands fairly well with the eyes open but loses balance when they are closed is a positive Romberg sign. In the cerebral ataxia, the patient has difficulty standing with the feet together whether the eyes open or closed. Now the test for the pronator drift. The patient should stand for 20 to 30 seconds with the eyes closed and both arms held straight forward with the palms up. Normally the patients hold with the arm position well. If necessary, patient can be tested in the sitting position. Pronator drift occurs when the forearm and the palm turn inward and down, and in both sensitive and specific for the corticospinal tract lesion in the contralateral hemisphere. Now instruct the patient to keep the arms out and eyes shut and tap the arms briskly downwards. The arm normally returns smoothly to the horizontal position. This response requires muscular strength.